How does a hip replacement work? Hip replacement surgery works by replacing the ball and socket of your hip joint. This is a hip model here. This is the front of your hip. This over here is the back of the hip. When I do a hip replacement, we make an incision on the front of your hip, what's called an anterior approach, and that means that I'm going in between these big muscles here, and we expose the bone inside.
Once we get into the hip joint, one of the very first things we do is remove the old arthritic ball at the top of the femur. And that ball on the top of the femur loses its cartilage in osteoarthritis, and part of the operation involves replacing not only the ball and also the socket. The new socket is made of titanium. It looks like this. It has a roughened surface that the bone grows into. It takes about 12 weeks for that bone to attach to the hip socket, and once it grows in, it will stay attached for the rest of your life. Once this is secured in the pelvis, we snap in this polyethylene liner, and it will give you about 30 years of service before it wears out.
Down below, on the femoral side of things, there's a titanium stem, and that goes into the bone down below.
We check with navigation and with robotics to make sure the leg length and the position of the implants is perfect.
And when we put everything together,
this makes up the new hip joint, replacing the old arthritic joint with a nice, smooth-moving joint ready to be used for running, skiing, and all kinds of different activities.